What do you make of what you've been hearing so far this morning? A, from the Republicans, repeal this thing and have a transition to a different system. And B, from the Democrats, is going to create chaos and make America sick again. Your reaction, sir?
Well, I would tell you that our health care system is sick because of Obamacare, and we do need to repeal and replace it. I mean, if anyone wants to make the argument that prior to Obamacare our health care system was sick, I would tell them that, and Obamacare was the cure, I would tell them that the cure has been worse than the disease. You know, I was just with health care providers last night at a meeting under which they were telling me the weight of Obamacare is breaking the system. And what you find is that people no longer have the access to the quality health care that we had prior to Obamacare, and all of it is being caused by these regulations and this current health care law. It absolutely needs to be scrapped, and it absolutely needs to be replaced.
Am I right in saying, and we've been saying this all morning, that if you get rid of the mandate that says you've got to have coverage, it's got to be this coverage, if you get rid of that, essentially you have gutted Obamacare. Is that accurate?
That's pretty accurate. I mean, at the end of the day, we're supposed to be living in one of the freest countries in the world, under which you can make people have the ability to make those types of choices. It's about individual responsibility and personal liberty. And again, you're right. If you eliminate the mandate that every person has to carry this type of insurance, then certainly you've taken a big chunk out of the health care law.
May I ask you this? Medicaid. Many people were covered under Obamacare, but were really shunted onto Medicaid, free health coverage provided by taxpayers. That is a state issue. What are you going to do in the state of Louisiana with those people who are on Medicaid because of Obamacare, which has just been repealed?
Well, we've always said, Republicans have always said that one of the best ideas about dealing with Medicaid is to block grant that money to the states and let each individual state make the determination of how to imply that money, how to employ that money across their particular health care services. I think that in one way you would find a huge cost savings, and at the end of the day, maybe save that Medicaid program.
Okay, sir. Look, thanks very much for joining us, sir. We appreciate this. This is an ongoing, flowing situation. I want to get back to the